Welcome to Mindful Bell Med. Let's talk about the medical assessment. First, scene size up. Dispatch. BSI, PPE, scene safety. Penman. P. Am I, my partner, and others on scene safe? E. Are there any environmental hazards? N. How many patients are there? M. What is the mechanism of injury? Or what is the nature of illness? A. Will I need for additional resources or call for AOS? And is there a need for extrication? And is there a need for spinal motion restriction? Next, primary assessment. What is my general impression? Are there any immediate life threats? What is the patient's age, sex, and position found? Is there a need for C-spine precaution? Do I need to treat any major bleeding or life threats? Next, determine level of consciousness and orientation status using APU and PPPT. APU. A. Is the patient tracking me as I approach? If not. B. Does the patient respond to verbal stimulus? If not. P. Does the patient respond to painful stimulus? If not, the patient is unresponsive. If the patient is unresponsive, check for a carotid pulse and breathing. If not, PPPT. Ask the patient, what is your name? Where are we right now? Why was 911 called? What year is it? Verbalize A&O scores. Establish chief complaint. If the patient is unresponsive, the chief complaint is alter level of consciousness or alter mental status. Next, assess ABCs. A. Is the airway open? If not, consider opening with head tilt chin lift or jaw thrust maneuver. Next, is the airway clear? Consider suction as needed. Next, is the airway maintainable? If not, consider placing an adjunct. B. What is the breathing rate, depth, and quality? Apply high flow O2 if indicated. C. What is the capillary refill time? Is there any obvious bleeding? If so, treat immediately. What is the pulse rate, rhythm, and quality? What are their skin signs, color, moisture, and temperature? Consider initiating shock treatment, giving high flow O2, position the patient on conditions. If the patient has, for example, hypovolemic shock, put the patient in supine position. If the patient has congestive heart failure, consider positioning the patient in high Fowler. Conserve body heat and rapid transport. Next, obtain vital signs. Pro bells. P. Pulse. R. Respiratory rate. O for O2 saturation. B. Blood pressure. E for eyes finding. Is it pearl? L for lung sounds. And L for level of consciousness and orientation status. S for skin signs. Again, color, moisture, temperature. S for sugar. History taking. OPQRST, sample. O for onset. Ask the patient, what were you doing when the symptoms began? Was the symptom begin suddenly, gradually? P. Provocation or palliation. Does anything make the symptoms better? Does anything make the symptom worse? How are you most comfortable? Q. Quality. What does the symptom feel like? Is it constant? Does it come in waves? R. Region, radiation. Where do you feel the symptom? Does it move anywhere? S. Severity. On a scale of 0 to 10, with 0 being nothing at all to 10 being the worst pain possible, how would you rate your symptom? T. Timing. How long have you had the symptom? When did it start? Sample. S. Again, for signs and symptoms. What sign or symptoms occur at the onset of the incident? A. Allergies. Are you allergic to any medications, food, or other substances? And what reaction did you have to any of them? M. Medication. Are you currently prescribed any medication? If so, what are the doses? How often do you take the medication? What prescription or over the counter medications or herbal medication have you taken in the last 24 hours? Have you taken any recreational drugs? P. Pertinence past medical history. Do you have any history of medical, surgical, or trauma occurrences? Is there any family history that should be noted? L. Last oral intake. When and what did you last eat or drink? Also, if applicable, when was your last menstrual period? Or ask relevant questions like, when is the last time you take your blood pressure medication? How much insulin did you take last? Did you eat after getting the insulin? E. Events leading up to the injury or illness. What are the key events that led to this incident? What were you doing when this illness started? Next, secondary assessment. Perform focus assessment using IPA or OPA. Focus on affected body part or system. I for inspection, P for palpation, A for auscultations. O for observation, P for palpation, A for auscultation. Then state few impression of the patient. Then state proper intervention or treatment needed. Note, prior to administering any medication, check 9 rights and contact medical control. 1. Right patient. 2. Right medication and indication. No contraindications. 3. Right dose. 4. Right route. 5. Right education. 6. Right to refuse. 7. Right time, meaning time between doses, expiration date, condition of the medication. 8. Right response and evaluation. 9. Right documentation. Next, reassessments. State how and when you would reassess the patient to determine changes in their conditions. Reassess an unstable patient every 5 minutes. Reassess a critical patient, for example, someone with cardiopulmonary arrest, every 2 minutes. For stable patient, reassess every 15 minutes. Next, obtain a second set of vital signs. Probells. Note trends. Did the pain decrease? Did the O2 saturation increase? Finally, provide an accurate radio report. That is all for the medical assessment.